Let's go to Perth now and catch up with infectious diseases physician Dr Clay Golledge. Good to talk to you again, Clay. First up, Astrazeneca, that advice from Atagi, did that do a lot of unintended damage?
Oh, hi, Chris. Yes, I think it did. As we discussed before, I am very disappointed with the Atagi advice. I was disappointed with the initial advice, but when they flip-flopped to 60, then that was really the death knell of the vaccine. And we've been facing an uphill battle ever since. And, we've got millions of doses of AstraZeneca to utilise, and it is still a very good and safe and effective vaccine. Your risk of death is 1 in 2 million, and hopefully will be even less than that. I know there's been a couple of recent deaths, but with effective diagnosis and treatment, it should just about be eliminated. But your risk of dying of COVID, if you're susceptible, is significantly higher than that. So we need to use AZ. There's no doubt about it.
Yeah, it seems just incongruous that we're exporting AZ now to other countries who are more than happy to use it, yet we won't use it ourselves. And of course, the UK, a country most Australians know and appreciate very well, that's been the live example. That country has been rescued effectively by AZ.
It has. Look, and it's a very effective vaccine. There's some new data out now that immunity with AZ may be very long-lived as well. And look, if you get your 2 doses of AZ, and if you do need booster doses, you'll get a different vaccine as time goes on. But look, the bottom line is, Chris, that we need to protect ourselves, and we need to protect ourselves. And what AZ does very well is protect against severe disease, hospitalisation, intensive care and death. So, it really is a no-brainer as far as I'm concerned. It's been good enough for me as an expert in the field to have AZ, and it makes me really, really upset that people say, I'm not going to have AZ and I'm going to hold out for Pfizer in the mistaken belief that this is a significantly superior vaccine.
Give us your thoughts on the vaccination rates we need across the country before we can put lockdowns behind us, because I would have thought with everybody in aged care taken care of, given that they're the most vulnerable group and certainly proved to be last year, and with more than 3/4 of those over 70 getting their first jab, we're actually in a much better situation. We're much further advanced to protecting our community than a lot of the medical experts and certainly the politicians tend to suggest. They're saying we need 70% of the whole country fully vaccinated before we can open up.
Yeah, I think unfortunately, though, we talked a few weeks ago before Delta had taken hold. Delta has changed the ballgame somewhat in that the fact that, a number of patients are now in hospital with it. I would have been very happy to have said a few weeks ago that we're perhaps looking at a vaccination rate of about 50% before we could widely open up. I think we're probably going to have to take that up a bit higher now in the fact that the transmissibility of this virus is so much more with Delta than it was with the other variants. So I think we're going to need to get higher vaccination rates. And the only way we can do that is if we do much more administration. We've got to get it into the pharmacies, more GPs doing it. We need mass vaccination hubs. Well, we can't achieve it with Pfizer alone, and we can't wait for Moderna, we can't wait for Novavax. So people have just got to man up, woman up, or whatever you want to call it, and have AZ. Look, to give you a figure, I'd just be guessing at the moment, but I think we're really looking, if you look at the attitude from the state premiers, we're looking at rates around about 70 to 80% before we can say, look, let's just avoid lockdowns altogether. I hate lockdowns. I think it's such a blunt instrument. I'd much rather see, for instance, in South Australia, you could have done it much better with just identifying those contacts and home quarantine. I hear they've just sent them all off to Medi hotels, which is just ludicrous, absolutely ludicrous. But look, I just think we've got to get a higher vaccination rate. We've got to, Nick Coatsworth mentioned 50%. I think we're probably going to have to get higher than that, unfortunately, before we can say we're going to avoid lockdowns. I think we're going to be looking at that for the next couple of months, at least probably well into the middle of spring, but contingent on much, much higher vaccination rates.
Yeah, that puts us into the middle of spring. That's the sort of timetable we've heard from Professor Peter Collignon as well. And when you're talking about that higher transmissibility, even though it's through a younger cohort, are you suggesting the main problem here then is making sure we don't overwhelm our health system? Or do you suggest that we could see fatalities in those younger cohorts too?
Look, I think both. And I think I can only speak for Western Australia at the moment. We've got a health system. We've got 2 code yellows in our major hospitals at the moment. I don't know what's going on in the public sector at the moment, but that seems to be overwhelmed for reasons that aren't completely clear to me. And it wouldn't take much to tip us over the edge here in Western Australia. So look, that's a worry certainly for us locally. So look, I think we've got to avoid hospitalisation wherever possible. Yes, young people are getting sick with it, and it's evidence you can see from other countries with experienced Delta outbreaks that young people are getting sick with it and ending up in intensive care units as well, or by unvaccinated young people. So only the minority of young people that are getting sick are the ones that are unvaccinated. So we've really got to look at vaccinating younger people as well, and the unpalatable thing to many people of vaccinating children as well eventually. And, I think we've got to start with year 12s and get down to that sort of level of age and then take it down even younger as we go forward.
Great to talk to you, Clay. I appreciate it.
Thanks, Chris. All the best.
Dr Clay Golledge there from Western Australia.